In this module, we'll talk about cytogenetic disorders involving autosomes. I've already told you what autosomes are. We have 46 chromosomes. 44 of them are autosomes, meaning they do not contain any information regarding sexual determination or differentiation. The two, X and Y, are the sex chromosomes. So the disorder we are going to talk about is the most common type of autosomal aneuploidy, trisomy 21, or also referred to as Down syndrome. It arises from meiotic non-disjunction. Normal parents, 95% of the time, extra chromosome comes from mother, and maternal age plays an important role in it. The role is very significant. For example, 1 in 1550 births for women under 20 will have, if we are talking about births in women under 20, 1 out of 1550 children will have Down syndrome, whereas when we move to women category of over 45, 1 birth in 25 births, there is a probability the child will have Down syndrome. 4% of the patients have Robertsonian translocation, 14-21. 14 is also an acrocentric chromosome, 21 is also an acrocentric chromosome. We won't talk about this since it is slightly beyond the scope of this course, but I just wanted to mention that 1% of the patients are mosaic. That, what do I mean by mosaic? That their cells, all their cells are not the same genetically. Some cells will have an extra 21 chromosome. Other cells will have the normal number of chromosomes, which is 221 chromosomes, and the total number is 46. So the severity of this disease depends upon the degree of mosaicism. So if we are looking at a mosaic patient with mosaicism, the severity will depend upon how many normal cells this particular individual has. Some of the features of this disease are single palmar fold. It is a very significant feature, very clearly visible in these patients, most of these patients. This is also called the simian crease. This is what I mean by simian crease in the hand. These people have epicanthal folds, or sort of eyes like people, Oriental people, or people of Chinese origin. These people also have a flat facial profile. The IQ of these patients is between 25 and 20. Also, majority of these patients have cardiac malformations. Next, I would like to show you a photograph of patient with Down syndrome. Here's a photograph. These people are generally very friendly, fun-loving, and jolly type of people. You may have come across this since it is the most common cytogenetic disorder of autosomes. Next, we will talk about cytogenetic disorders involving sex chromosomes.